So this is a superlateral surface of the cerebrum, and this is a very easy technique to learn all the sulcus and gyri of the whole surface of this particular area of the brain. First of all, we are going to know what is sulcus and gyri. Sulcus are the depressions, and gyri are the elevations which you will find, like this particular thing, this particular depression sulcus, and this one is the gyrus. Now the main sulcus in the between is known as the central sulcus or the sulcus of Ronaldo. As this sulcus is after it is known as the postcentral sulcus, and this is before it, so it is known as precentral sulcus. Now these two are present in the front. This is the frontal lobe, and you always have to remember, whenever you are drawing this particular surface of the brain, the frontal lobe must be always in front of the temporal lobe. This is the temporal lobe. So the sulcus and gyri related to this frontal lobe will be named after the frontal surface, and these particular sulcus and gyri of the surface will be named after the respective temporal surface of the brain. So this one, as it is upper than this particular sulcus, is known as suprafrontal sulcus, and this one is below it, so it is known as infrafrontal sulcus or inferofrontal sulcus. This is also upper side, so it is known as supratemporal sulcus, and this one is infratemporal sulcus. Now look at this one. This is a parietal lobe, and this sulcus is separating the two lobes, and this is known as interparietal sulcus. Now here you can see this moon shaped sulcus. This is known as a lunate sulcus, that is moon shaped, and this particular sulcus, this will be very visible on the medial surface, but for now you can remember this as a calcarean sulcus. There is a branching type of sulcus over here, so this is known as anterior horizontal lateral sulcus, and you can also call it as the ascending limb. Now for the gyri, you have this is a very easy one because it's always related to the name of the respective sulcus which is associated with it. So it is known as the postcentral gyrus, precentral gyrus. This one is known as supraparietal gyrus. This is known as infraparietal gyrus, and respectively. So right now we are going to learn about the respective areas associated with it, which is very important. Now the numbers is or are the Brodmann's classification. These are not named after a particular sequence that you have to learn this by heart. I mean, these are all discovered, and the numbering was given as per the discovery. This is the area 312. 312 is the area which is in the postcentral gyrus, and this is mainly associated with the primary sensory area. The area 4 is located on the precentral gyrus, and this is the area 6, which is a premotor area. Area 8 is located in the middle frontal gyrus, and this is usually associated with the frontal eye and the field vision screening. You can screen a particular situation, you can name, and you can actually call it, and you can actually name it and find or just remember that yes, we can particularly see this, and kind of having a bit of eye movement and remembering things, so it's associated with it. Now we have the very important area over here. This is area 22 and area 41-42. Area 22 is usually for the memory based language comprehensions, whenever you want to remember a particular language, this will be interpreted in this area. And 41-42, you all know this is a very important kind of the primary auditory area. Now we have 39 and 40 area over here. This is in the kind of, you can say, close to the inferior parietal gyrus. So this particular thing is very important, and this is in the angular gyrus and the supramarginal gyrus, and this is usually responsible for the language interpretation. This one, the area 22, was memory of language interpretation, and this one is for the language interpretation. You can understand that a particular thing which you are saying, maybe you can't speak a particular language when you don't know anything. You have to comprehend it. You can always relate to a particular language, then only you can know. So these two areas kind of hold that thing. This is the memory language, and this was the only language. Like a particular area, when these are harmed, you cannot, like, the person will talk in a language, but you will never understand what the person is saying. They will talk in a different language, and the language is very hard to comprehend, and which is the defect is in a sensory aphasia. These two areas are very important. These is area 44 and 45. The Broca's area, which is a motor speech area, you all know, and this area is actually 17, 18 and 19. These are associatory visual, and these are primary visual sensations. So the memory and thing, or the interpretation, will take place over here, and the sensory part will be taken over here. So area 22, 39, 40 together will constitute the vernix area. This is very important. Now if you come to the middle lobe, I'll just quickly tell you all the sulcus and gyri over here. You can always see this is the major thing, which is known as the corpus callosum. This particular sulcus is known as supraparietal sulcus, as it is present on the superior surface of the parietal. This is the parieto-occipital. This is occipital lobe. This is parieto-occipital sulcus. This is the calcareous sulcus. This is the rhinal sulcus. This is the collateral sulcus, and this is the occipitotemporal sulcus, that is, as it is dividing the occipital and the temporal lobes. We all have to remember this one. This one is cingulate sulcus. This is very important, and the gyri respected to is obviously the cingulate gyrus. This is a precentral lobule. You know what is a lobule? Whenever gyrus is increasing its size, we call it lobule. So this one is a lobule. Paracentral lobule. This is the highest center for maturation and defecation. This is very important. This particular gyrus is known as parahippocampal gyrus. This is known as medial temporo-occipital gyrus. This is known as lateral temporo-occipital gyrus. Whenever we come to the inferior surface of the brain, we always have to remember this is the olfactory tract, or you can say the olfactory sulcus. There is an H-shaped sulcus over here, which is known as occipital sulcus. This one is a lateral surface. You can always see this is a margining of the brain. So this is lateral, this is medial, this is anterior, and this is posterior parts of this particular sulcus. This is known as uncus gyrus, and this is the uncus. This is parahippocampal gyrus. This one is the medial occipitotemporal gyrus, and this is lateral occipitotemporal gyrus. This is the midbrain, you can see, and this one is a straight gyrus. This particular lobe, when you will see the viscera of the brain, you can always see there is a gyrus which is just straight to it. So this is known as a straight gyrus. So I hope you have understood, and thank you for being patient and seeing my video. I will be very thankful if you can subscribe and like this particular thing.